Welcome everybody to today's Beautytap Talk, where we are sitting down with the beauty industry's most revered luminaries. Today we have Dr. Tess Mauricio, a Stanford-educated dermatologist. We have Kat Burki, who is the founder of Kat Burki Skincare, a clean, luxurious skincare brand. And we have Kiana Cabell from Kopari, another beautiful, clean skincare brand that is infused with the miraculous coconut. Welcome, everybody. I'm so happy to have you all here. Welcome.
Thank you.
Thank you.
So today we are getting into, it is that time of year, we are getting into how to deal with, cure, treat dry winter skin. Let's start with Dr. Tess. Dr. Tess, tell us what we're seeing right now, what we can do to treat dry skin, what we should be avoiding, and ingredients to look for.
Wintertime, there are many more patients that are coming in, obviously complaining about their eczema. If they're eczema prone, it's really coming. They're getting itchy. They're getting breaks in their skin. They're getting rashes. Even our acne patients that are using products that have benzoyl peroxide, retinol, are finding that their skin is just more irritated and red. And so we really have to customize our skincare routine and how we manage our skin during the wintertime. When we have the heaters on, the humidity inside is really down to almost nothing. And so if you are eczema prone, if you are using products that can potentially dry the skin, you really have to give our skin, more TLC. And the easiest thing to do during the wintertime, which I tell my patients, is one, switch from a gel cleanser into a cream cleanser. Another thing is that if you are using products like benzoyl peroxide, glycolic acid, any of the acids, and retinol for sure, then you may want to skip a few days. So, skin cycling is really in right now. And really, this is the time to do that, where you still want to continue using the ingredients that really help the skin, whether it's acne, anti-aging, but you may decrease the frequency of use. And then also, those who think that they have more oilier skin, you may want to think about using moisturizer on a regular basis during the wintertime. And obviously with more mature skin, and I see I see patients like that as well in my practice, because we have a huge anti-aging rejuvenation practice. As the skin matures, we really don't have as much moisture. And especially after menopause, you also have more issues. So picking the right moisturizer that doesn't cause acne for acne-prone patient, but also bring in and lock in the moisture with good ingredients. Look for ceramides, you look for hyaluronic acid. And so to bring in that moisture back. And then, consider really applying an oil. Protect the skin before you even go in your shower. And so prepping the skin before your shower, and then not using super hot water, when you're in the shower or baths. And then immediately after, applying cream moisturizer. I really feel like lotion is just not good enough for most people. So
I feel like most lotion is water-based, right? Whereas in cream is oil-based. So I think this time of the year, like, that's really what your skin's needing.
Yeah,
Sorry.
those are
excellent
tips, Dr. Tess. Definitely with, the heat, from the heater going back and forth, that really has an effect on our skin. The dry air, which I'm always feeling. I do put a humidifier in my room. I know that's beneficial. And you touched upon ingredients, which I know with our two other guests here, hyaluronic acid and ceramides are ingredients in some of Kat Burki's and Kopari's skincare. Now, Kat, you have 20 plus years in nutrition, health, and epidemiology. I'd love to hear a bit from you about your products, about your ingredients. You also, your products are cold processed. And then we'll talk to Kopari, Kiana's Kopari the co-founder of Kopari, about the coconut and all the wonderful benefits of coconuts and coconut oil. So Kat, I'd love for you to weigh in on your cold processed skincare.
Yeah, I mean, I think all those points were so spot on. Definitely when your skin is dehydrated, the pH level is off, a whole cascade of issues can start. So moisturizing is like the number one importance, and we feel it all. I feel it just from being under the weather, and antibiotics dehydrate your skin. So definitely it's the time of year, but botanical hyaluronic in general is a better hyaluronic type of hyaluronic acid. As opposed to a sodium base, because sodium base is just what it sounds like. It's going to plump up artificially, but it's still sodium. So something more natural, like a botanical. B vitamins are one of the best. B5 is really strong. It actually increases your own water to your skin layers. And another thing that's like that, because all of these they have different elements of how do you get moisture to the skin. One is grabbing moisture, which hyaluronic does from the air, from the environment, and the rest is like from your own body and getting it into the like peptides, get it to the different layers of the skin, and they build up so peptides are awesome. Seaweed is really great. You know, the seaweed wrap that really keeps the moisture there. It's really interesting that it has polysaccharides that actually allow you to bring your own water to your skin. And, you know, just obviously there's food also that are great at that. Obviously drinking water is a great one. Avoid the caffeine, avoid the alcohol if you can. And then just nuts and really good fats like avocado are really great at increasing your own hydration in your skin.
Great tips. I love my nuts and I love my water. And those are great reminders for everybody. Everyone load up on that water and load up on those omegas. Thank you, Kat. I also am so intrigued by your KB5 complex. That's the crux of your products. I know how important reducing inflammation and calming skin is. And we can chat more about that. Let's hear from Kiana from Kopari and the wondrous coconut. What would we do without coconuts? We love drinking them. We love eating them. We love putting them all over our body.
Definitely. And they're all very good for hydration, whether you're drinking it or you're putting the oil on your body. But I would say, you know, coconut oil, and it's why I fell in love with it. It's just so hydrating. And, you know, I think as you're coming into these winter months, whether it's, you know, just overly dry from the weather, the wind, your skin's chapped, it's more sensitive, you're having eczema flare-ups, different things like that, you know, using oil on your skin just really helps to lock in the moisture and barrier repair. And coconut oil is so great because it's antibacterial, it's antimicrobial, and it has so many great properties. So I personally love. I'll either like, we have our coconut melt, which is our, you know, most organic premium coconut oil, and it doesn't have any synthetic fragrance. So it's really nice for skin right now, especially if you're sensitive, dry. But I'll just scoop like a big glob and put it in the bath. So it really helps to kind of like lock in that moisture in the tub. Or I'll just put it on like damp skin when I get out of the shower. And it just really like seals everything in and just doesn't allow anything out. So you're really getting all that, you know, amazing moisture. And you know, I think Tess had some great points. I think a lot of people, you know, get in the shower, it's too hot, they're taking too long in the shower. I think, of course, it feels really nice when it's chilly outside, but I think that's really stripping your skin. So, you know, like she had mentioned, like switching from, you know, a more surfactant, like gel-based body cleanser, face cleanser, and something more nourishing, whether it's a cream or, you know, shower oil, is really great for your skin as well in these winter months.
You know what I love to do, and I'm assuming this is a great thing to do with the coconut melt, is instead of getting out of the shower, drying off and putting on your melt or your lotion, putting it on when your skin is still damp in the shower. What do you ladies think about that?
I actually have tried Kopari's coconut melt a lot, actually. And I like to put it on before I go in the shower.
I heard you say that. I've never tried that.
Yeah, so I mean, this is what I tell my patients, so that, you know, you have the heat and the humidity in the shower that locks in, and then also especially a lot of my patients, they don't like any kind of greasy feeling on their skin, and then they're worried that it'll get on their clothes after. So I think before, for me, works great, locking it in, and then afterwards putting on a cream moisturizer. The other thing is, if you do have problem areas, and a lot of patients may be complaining of dry areas, specific like their hands getting a lot drier now, with all of this, with the pandemic, washing our hands all the time. A good thing to do is you can use the coconut oil, the balm, or your Aquaphor or something like that. Put a lot, and then wrap your hands in like a saran wrap, or wear like cotton gloves, and sleep with that overnight. And it really locks in the moisture, protects the skin, and then restores the skin barrier function. And within like overnight, you can transform your skin.
Yeah, that's great. I've done that on my feet before.
Yes, I do it on my feet too, by the way.
Now, would you recommend, Dr. Tess, with that, some cotton type of gloves so that your skin can breathe?
So I've done both, because I have eczema, and so I've done both. Cotton gloves work well, but if you don't have it, you can just get your plain saran wrap, and I just do it, and it's fine. The only thing is just it slips sometimes. So,
Kat, I'd love to hear about your Vital Hydration Blast and also your collagen infused skincare. I am a big fan of the Form Control, your new neck gel.
Oh, nice. Yes. I love that too. So they're two very, very different. So the Vital Hydration Blast is utilizing a complete B vitamin complex. B vitamin is the #1 vitamin for any kind of protein repair. So it's really great to have in, we mesh it with neuropeptides, because of the repair of the skin. Our body does repair itself, which is pretty darn remarkable. So giving it the tools that it needs to do that. And then we have the neuropeptides that come in, and neuropeptides kind of act as almost like a reinforcing the barrier. So as it repairs. So really almost, I'm thinking about what ingredients we were talking about before. I think most of them are in that product, because it really is about getting in there and hydrating, and but allowing to, one thing I do like about coconut as well is it does allow your skin to breathe at the same time, which is super important, so bacteria doesn't get trapped and all that kind of stuff. And it allows it to to absorb other ingredients if it's not blocked. So on top of that, we have the new collagen product. So what we're utilizing is collagen, so an algae collagen, the big algae, seaweed, the benefits that come from it, from minerals, and also getting in there and fermenting, that allows your skin to actually do amazing things on its own, have those elements in it. And we use collagen boosters such as reishi mushroom, plant stem cells, silk amino acids, things like that, to really help build the skin back. So yeah, those are two. Thank you for asking. I love that new product too. I've been using it a lot.
Yeah, and I've been really enjoying it and seeing a difference. And Kiana, I'm intrigued. Haven't tried this product yet, but the whipped ceramide cream, which I love the name of. And also, I would think that the coconut spritz would be a handy dandy little item to have on hand all throughout the year.
Yeah, definitely. We have a lot of great products for this time of year. Some of my favorites are the ceramide cream. So, it's packed with ceramide, so you really are getting that barrier repair. And it has this unique, I have it right here, it's like a whipped texture. So it just like effortlessly blends into the skin. And it's just so incredibly hydrating. And it just is like the most beautiful formula that doesn't feel like, it's like the perfect balance where it's not feeling too heavy. And then another one I would say for us is probably like our body butter. So it has hyaluronic acid, mango butter. So you're really getting that incredible moisturization on the skin. And I love Tess's tip to use the oil before the shower. I use actually the coconut melt itself on damp skin out of the shower. So I'd love to try that. And another secret of mine is taking, the body butter or like a rich body cream and then mixing it with oil. So I just do like a big scoop of each all over. And it really cuts with the oily feeling. Like I know you'd mentioned like people are concerned about oil on their clothes and stuff. I really don't feel very oily after I mix the two together. and the way it absorbs into the skin when you have both, it's just incredible as well.
We always get great takeaways. I had not heard putting the creams and emollients on before shower, so definitely trying that tonight. But I have found that applying body oils at the end of the shower definitely has helped. I'd love for each of you to weigh in about hyaluronic acid and why it's such a key ingredient, throughout the year, both for anti-aging, for hydration, et cetera. If you want to start, Kat.
Yeah, well, people like it because it brings water, it grabs water from the environment and brings it to your skin. So I like it for multiple reasons. I don't believe in just hanging your hat on hyaluronic acid. I think it's a lot more than that. Hyaluronic acid actually can be a great almost carrier where it brings in other ingredients as well into the skin. So it has multiple great factors to it. I think you kind of need to, when you start talking about hydration, you need to look at multiple things. I don't think it's enough. I especially don't think sodium hyaluron is the right one because it is going to give you kind of the sodium blow up and then you're going to deflate. So you actually, things like botanical hyaluronic and other weights of hyaluronic acid carry their weight, so to speak, in better ways and actually how they perform with other ingredients as well.
Thank you. Kiana, I'd love to hear your thoughts too, because I know it's a great ingredient in many of your products.
Yeah, no, we love hyaluronic acid. It's just super, moisturizing, and it really does help to kind of like lock moisture in skin and help from, the water evaporating out of your skin, which I think, is really drying. And that's where you kind of get a lot of that like dry, chapped skin when the moisture is lost and escaped.
Thank you. Anything else to add there, Dr. Tess?
I think, hyaluronic acid is like the one of the most common buzzwords now because there's like an ad that's like hyaluronic.
Exactly.
Definitely buzzy.
Like everyone's like, whoa, what is that? And so obviously in dermatology and specifically in cosmetic dermatology, right, we use a lot of hyaluronic acid. It's the only type of injectable filler that I use, and how it works to treat wrinkles instantly is that obviously that's injected in. It's a gel form of hyaluronic acid. And then it does, like Kat says, it attracts water in the area, and then that gives you that plumping effect. And so the fillers obviously you can use it to plump up the lips, the cheeks, other areas. And topically, obviously now more and more products are incorporating hyaluronic acid, whether it's a sodium hyaluronate or botanicals. I think many skincare companies are really pushing it towards more the natural, holistic, botanicals. And I agree with Kat that, when you're talking about anything, whether it's moisturization, anti-aging, it's really the products now are multitasking, and they really have a lot of different incredible, scientifically validated ingredients in there. So it's not like, you just have hyaluronic acid, but many great products there have hyaluronic acid, the botanicals, the peptides, which I love, plant stem cells, growth factors, exosomes, like we discussed before, Elycia. And so skincare products are just so exciting. This whole category, always new innovation. And also the delivery system, because part of the efficacy of any product, of course, is the delivery system, which is why I was suggesting the concept of keeping a moisturizer overnight under occlusion, because if it's just sitting on the surface of your skin, it's really not doing what it's supposed to do. So really the delivery system of these incredible ingredients is key.
Exactly. So important. And I think so it's not a one ingredient story. It's how they all work together, because they're going to just make each other stronger, hopefully. And also, how do you deliver that? So obviously there's injectables. That's how you deliver that. That's done. But in skincare itself, it needs to get through and it needs to do its job at that skin level. So exactly. It's a really important, almost just as important as the ingredients. Otherwise the ingredients can't do anything.
Tess was mentioning earlier, like not, using the acids and, maybe those harsh type of ingredients this time of year, but not, switching everything up at once. But just making sure you have the right products and you're layering in the right ingredients.
Sometimes less is more, right, ladies?
Yeah. Well, I think I talked to people and they wanted to be like, oh, okay, what can I do to change up my skincare? And they change everything. And then their skin's reacting because they have so many changes going on. And, I'd say one of the most important ones I would feel is like sunscreen. I think people, see it's gray and dreary outside, so they drop that out. But I think that's also, something that's so important.
Thank you for bringing that up. It's so true. I am telling my daughter and sister that sometimes too, where, oh, it's cloudy out. I said, well, this is when you're going to get the burns when you go out with no sunscreen. It's very deceiving. So I guess unless it's snowing and raining, Dr. Tess, is it okay to forego the sunscreen on those days, or should we be applying it every single day, no matter what?
It's interesting because I just saw a study that even now that people are working remote and they're home, the use of sunscreen has gone down a lot.
That's interesting.
And are really not taking into account, like lighting that's coming from their windows, the blue light that's coming in. So I think we just need to make it part of our day-to-day daily routine, almost like brushing your teeth. It's like when you brush your teeth, you put on your sunscreen. And you're talking about skiing. In higher altitudes, there's actually more UV. Even when you're in an airplane, you can get more UV exposure. So I think just, putting it back to our routines, because I think when we were all home, and I'd say me too, it's like, what's the point? You're not going outside. And so we kind of got into this bad habit of not even thinking about sunscreen the way we used to prior. And studies are really showing that.
Yeah, I'm seeing a lot of blue light dedicated skincare these days. And yeah, it's a great reminder to put sunscreen on, like brushing our teeth, and also reapplying, because after 2 hours, the effectiveness has waned. Is that correct?
That's true. And also, if you do have issues with discoloration, pigmentation on the skin, protection from visible light is key. And so iron oxide, which is a component of some of the tinted sunscreens, is really important. So we're talking to our patients with those, discoloration issues about the use of tinted sunscreen so that they can have the protection of iron oxide, in addition to obviously, your zinc oxide and titanium dioxide.
Well, there's so much to cover here, and we have a lot to review. Let's just review what some of our big takeaways are. Drink a lot of water. This is to ward off the dry winter skin that we're all going to deal with at some point this winter. Drink a lot of water, get your omegas in through avocado, nuts, etc. Use a humidifier, which again, I find very helpful. Look for ingredients such as hyaluronic acid, ceramides, in combinations. Look for skincare. Again, we have Kopari and Kat Burki here with wonderful formulations, advanced formulations that have excellent delivery systems. Put on some creams and emollients before the shower. That was a really fun tip, Dr. Tess. And I'd love to, if you ladies can share what, if we haven't covered it yet, one of your favorite beauty secrets, whether it's for the season or year round, something that could be a little bit revealing, something unexpected. If you have something, please share. Kat, why don't we start with you?
Oh my God. Let's see. I don't know. I think the biggest thing for me is just to keep exfoliating. I know that's not that interesting, but I'm a huge believer in that, and my skin needs it. Like, it just builds up, and I think actually it will help towards hydration as well. If you get, just get the exfoliation at least once a week if you can. I don't think that's anything earth-shattering. So I don't know. I'll think about that.
Good to be reminded, though. I mean, it's so important because to me too, I need to exfoliate tonight. So thank you. You just reminded me.
And then hydrate after that. Yeah.
Yeah, Dr. Tess?
Okay, so mine is, start a relationship with one of your dermatologists because it's a journey, right? Beautiful skin, timeless, ageless skin. There's so many great technologies as well that's available that can take your skincare routine to the next level. And so I think finding a dermatologist, a board certified dermatologist that you trust to be your partner throughout your life, I think is great. And then of course, just doing the self skin exam as well, because sometimes it's hard to tell if is it just the pimple, is it just the growth, or is it something that we need to biopsy, like with Chloe. And so that's really important.
Thank you. That's such a great reminder. And people often ask me for my skincare advice being in the world that I'm in. And I always recommend that they have a medical expert on their team. You can have the wonderful skincare, the Kaparis, the Kat Burkis, clinical level skincare at home, and you can be doing a beautiful job with your at-home care, but you've got to also have a medical professional on your side. And especially today with so many, skin diseases, and then also the other side of the fun stuff, all the anti-aging technologies. It's really an exciting time to be in this field. And I'm sure all of you recognize that in each of your respective fields. But yes, absolutely. Have a medical doctor in your corner along with the luxury skincare. Kiana, would you love to weigh in here?
Yeah, of course. I'm going to throw in a hair tip because my hair has been extra dry. So I just take the coconut oil or coconut melt and I just coat it from root to tip, and I'll just put it up in a bun and I'll sleep on it. My hair is so shiny and strong, and I notice a huge difference in how hydrated my hair feels. So I just colored it. So I actually did it last night, and it is so nourishing. So that's my tip.
Thank you. That's key. Of course, we're dealing with hair issues too. That's going to be a whole separate Beautytap talk. And again, the miraculous coconut, we're so grateful for it and all the amazing things that it does. So it's really been exciting to see the growth of both of your brands.
Thank you so much.
Yeah.
Thank you all for joining us today. Dr. Tess, Kat, Kiana, we really appreciate your insights. It's been a pleasure sitting with such luminaries of the beauty industry. And we look forward to hearing more from you. And hopefully everybody can glean something today and breeze through winter and all year round with smooth, hydrated, healthy, glowing skin.